So, good afternoon. So I know we all have a belly full of food, so I hope you'll be able to concentrate a little bit. My story should actually be able to keep you aroused a little up a bit or raise it a little bit. By the way, so I can upload this to my website or to the SlideShare website, so you don't have to worry about it. So all of that can be available. So what I'm going to do is, by the way, yeah, my name is Werner Sattmann-Frese. I am, what am I? I'm a psychotherapist, trainer. I'm running together with a colleague a master's program at the Jensen Human Institute in Sydney. I studied medicine and psychotherapy, social ecology, and mainly work these days as an educator. But I still have some clients, some psychotherapy clients in body psychotherapy and some supervisees on Monday afternoon. So what I'm going to do is, I actually shortened the whole thing a bit. I guess I saw it coming that things get a bit condensed. So that has 4 parts. I think we only go through 3 parts. The first 2 are sort of, I should say, like an introduction, references to Sri Aurobindo's and the mother's work, the Upanishads. Then a little bit on the bigger picture of us as people in the universe among viruses and other microorganisms and how it all hangs together. And then as a third part, I'll tell you 6 stories from a practice of a psychosomaticist and body psychotherapist. The fourth part is really then slides that, in a sense, provide you the theory to these 6 stories. So we can skip that, and because you can then, in a sense, look at that at home. Yeah. So that's the plan. So, and if you have a question, so you're most welcome to. So I'll be reading some bits and pieces, but otherwise, then the stories, I'll just share the stories with you. Now, this is all about consciousness, or rather the lack of it in medicine, in conventional medicine and psychiatry. So that's sort of what I'm involved in, obviously, and I hope that the stories that I'm sharing will sort of really document what this lack of consciousness, unity consciousness, other consciousness is. I think it will also make quite clear what sort of consciousness we have to develop. And I think what I'm proposing, what you will be hearing and seeing, is, I think, part of the supermind consciousness, a small part of it, I would imagine. So, obviously, this is all about body, feelings, psychosomatic medicine, these sort of things. So, man's highest aspiration, his seeking for perfection, his longing for freedom and mastery, his search after pure truth and unmixed delight, is in flagrant contradiction with his present existence and normal experience. So who we want to be and who we are is a huge difference. And most of us are rather sadly very unconscious. Now, I'm probably speaking here to the converted. It doesn't apply to you here. I guess I'm talking sort of the general society out there, the patients that come into clinics and so on. So we are embodied beings, so we are here as bodies. It doesn't mean we are not more than that. We don't quite know what else there is, but clearly we are more than the body, but nevertheless, for all intents and purposes, this is sort of our existence here at the moment. So Sri Aurobindo observes, all working of mind or spirit has its vibration in the physical consciousness. So records itself there in a kind of subordinate corporeal notation and communicates itself to the material world, partly at least through the physical machine. So we are a highly, highly complex physical machine. Now, to even compare us with the physical machine doesn't do the human existence and body justice. But anyway, and of course there is more, there is spirit, and we are all embedded in a lot more. But the body of man has natural limitations in this capacity which it imposes on the play of the higher parts of the being. So there is this relationship between us as bodies, higher parts of being, And we have a sort of, as I will, there's this idea of a world body, which is actually now has been confirmed through contemporary genetics. So that also will be my first part. The answer is not to take the more traditional route of denigrating or avoiding the body and its needs. The body is given to us as one instrument necessary to the totality of our works, and it is to be used, not neglected, hurt, suppressed, and abolished. But that's what I'm dealing with as a clinician. People who repress their feelings, who distance themselves from their feelings. And sadly, as you all know, certain yoga practices, the more ascetic types, also try to sort of deaden the body. So, and thanks God, that's not Aurobindo's and the mother's way, as I understand it. They want to take us as healthy bodies into the growth. So we need to grow at all levels, body levels and, I guess, soul, spiritual levels. And there are some obviously interesting stories. I'm a newbie when it comes to the work of Sri Aurobindo and the mother. I've been meditating of the Zen variety since 1983, so that's more the thing I've done in the past. But anyway, so a story from the Upanishads. Which are the most important powers in the universe? Ether, air, fire, water, or earth? Once these powers made the boastful assertion, we hold the body together and support it, whereupon prana, the primal energy supreme over all them, said to them, do not deceive yourselves. It is I alone, dividing myself fivefold, who hold together this body and support it. And prana is breath and energy, in my understanding, and that's what I'll be talking a lot about in my stories, because that's really what body psychotherapists are dealing with. Energy that is stagnating and that needs to be mobilized, and then lots of amazing things can actually happen. A divine life in a divine body is the formula of the ideal that envisaged. So again, this really total speaking up for the body and the body-mind integration. What will be the nature of this body, its structure, the principle of its activity, the perfection that distinguishes it from the limited and imperfect physicality within which we are bound? That's the question. Yeah? So the question we are dealing with, in a sense. Now, I hope that what I'm presenting is, in a minute, will be part of the answer, maybe. And living is a total organismic experience involving all the senses, including intuitive sensing. Even in dreams, we are fully organismic alive, probably living our life in our junk gene world. What that means, all of you, what we have in our body, the genetic code, only 10% actually, is about us as physical bodies. It creates the body that we see and the physiology to operate it. 90% has been seen as junk genes until very recently. Now they're realizing there is no junk. It's probably actually the history of our ancestors inscribed in our genetic code. And that's what we are getting to when we dream. And for other purposes, there will be some slides about that. And living is an integral event, being embodied, being interconnected in time and space, sensing the world around us. And all these 5 days have been about these faculties: hearing, sensing, viewing, sort of being visible, smelling, intuiting, feeling, and then the somatic expressions, the body songs, such as burping, farting, all these taboo things that nobody wants to feel and talk about or commit to. And finally, the consciousness. That's what we always talk about here, consciousness, how to enhance consciousness. And there's so many different ideas on consciousness. We touched on so many things, but obviously what I'll be doing here is one particular focus of body-mind consciousness. So it means different things in different fields of inquiry. Here, today, what I'm presenting here, it relates strongly to our misconceptions of what it means to be embodied beings, including illness. Medicine has a disastrous understanding of illness in some respects. In other respects, it does amazing things. We have a neurosurgeon here. Surgery is one of the fields that is amazing, that has had amazing progress. And then there are other fields in medicine where, I hope you won't rip my head off for saying this, where medicine is not even really somatically literate. It's almost blind to certain things. We call that somatic illiteracy, psychosomatic blindness, and it still is sort of caught up in a friend-foe understanding, and we have to fight cancer. It's all about war, now, which doesn't make any sense, as you will see in a minute. Somatic means the body. It's soma is the Greek word for the body. Sorry? Somatic means the body. Literacy means to know about, to have words for, to know a language. That means we actually don't understand body language. You'll see what that means. So it's a lack of understanding of embodiment in many, many shapes and forms. Exactly, but in conventional medicine, it has a very mechanistic understanding. That exactly is missing in Western conventional medicine. And that is part of that illiteracy, but there is more. So the learning challenge here is obviously for us to enhance our ability to harmonize body and mind, in a sense then also to transcend that. We also talk about person-planet unity. It's a terrible term. The term ecstasy is much nicer. That's actually the other term for it, ecstasy, whereby ecstasy is not necessarily amazing bliss. Ecstasy is just not feeling neurotic, just feeling present to oneself. Have you ever swallowed this funny ecstasy pill? It actually does the job. I've done it twice. I used to be a drug addict. I've done it twice, and it does exactly that. I always felt like I'm not neurotic. I'm not inhibited. I understand. I'm not doubting myself. I feel connected with everybody. Amazing. It wasn't blissful necessarily, unless we define that already as bliss. So. Illusion? No, I would rather think what we are doing here is illusion. So that's not being connected, feeling sort of cast out from the creation. I think we are in the illusion, really. Anyway, so the world within us, so that's the second part. Oops, do I have about 45, 50 minutes? Something like that? Yeah, good. I'm sort of racing through it a little bit. So, in the most crudest sense, oh no, I'm fine. Oh yeah, okay. In the most crudest sense, we need that for a moment. We are 34 trillion cells in our body that have the stamp of me, Werner Sattmann-Frese. That means that have a genetic identity of me. We have 100 trillion microorganisms in us that are not me. So the idea of becoming the sterile human being or the sterile being that sort of medicine constantly alludes to, making us sterile, is ridiculous. The only way of making us sterile is to cook our bodies for half an hour. But then everything is dead. We are sterile, but we're also dead. So 3 to 5% of us is not us. The combination of microorganisms with which we normally live in a kind of symbiosis. And then everything is happy. The microorganisms are happy, and we are happy. And then, of course, 57 to 60% of us is actually water. So there's not a lot there of actually us, really, when you think of it that way. So only 10% of our genes relate to our physical body. And as I said before, 90% is this junk stuff where geneticists now understand through the work of Lindley and Pullman and other people what it is. It's history, it's learning, it's like the library of our experience and the experiences of others. So, yeah, thank you. Next one. Now, something very interesting to see how in nature microorganisms and viruses, which is really gene fragments, constantly inform itself. Virus in medicine is something that needs to be killed, which is completely ridiculous. We actually need them. It's learned experience that is shared. Viruses are the words of nature. We talked about words yesterday. Viruses are the words of nature. And it's words where human beings, monkeys, pigs, and lice and mice all can actually share genetic code. And we can all learn from each other. Just to give you one example, in the world's oceans, 90% of the biomass is microbial. And with viruses, turning over 20% of that daily. So viruses are the communication system with which these microbes learn from the experience of others, and that gets constantly shared. It's no wonder that we're losing the so-called war against germs. We can't win that war, which is interesting because as we speak, our capacity to use antibiotics is coming to an end. You know, lots of people, for lots of people, it won't work anymore as of pretty much now. So as bacteria are incredibly diverse, then the viruses that infect them, fungus, are even more diverse, and so on. So thank you. So the meaning of that is astounding. We not only contain the genes of our parents, but gene fragments of all their lovers. One of my sons was born with a very brown hair, which I thought, what has my wife done? Until we are really, not really, but now it became much clearer because all her lovers, and she had a long time a relationship with a Turkish man, that's his genes. But should we actually have pure genes? I think that is an illusion too. We shouldn't have pure genes. We are an open, ecologically open system. Even the idea, I want that pure person, your pure genes only from one lover, I don't know whether it is actually useful. You know? Some people say genetic diversity is actually what keeps us healthy, you know, as a society. So we constantly learn from other organisms through the exchange of gene fragments. What we are discussing here today will be passed on genetically to our children, probably even epigenetically through the exchange of fluid. So watch out who you're kissing tonight. This talk you can pass on through all sorts of body fluids. That's what contemporary genetics has actually learned. If you want to know more about that, there's a book by Robin Lindley. She's one of these new contemporary kind of genetic researchers. And so there is amazing stuff out there. The mind boggles. So thank you. Yeah, if you could continue. The idea of horizontal, or the reality of horizontal gene transfer is not new. It has been around for a long time, so it's just part of nature. And that's why we can't win the war against germs, because they become immune against our medicine, and they immediately pass the information on to others. So how can we ever win that war? We should stop winning wars, or even fighting wars. So that's that bit, if you just continue for a second. Yep. So now I'll tell you some stories. So that's really all there is. I think the last bit is really stories. So I would like to give you some stories from clinical practice of somebody who deals with psychosomatic medicine and somatics. And I think that more than anything else shows how blind we are in relation to what the body does. So the first story is a man who came to see me with a nervous breakdown. He had what we call a nervous breakdown, a psychotic episode. He was there profusely crying, shouting, being completely overwhelmed, sitting there, didn't know what happened to him because he never had anything like that. So most psychiatrists would have, so I'm not a psychiatrist, I'm a body psychotherapist. Psychiatrists would have briefly talked to him. It was really severe, maybe sectioned him to a hospital or given him antipsychotic drugs. That's how it works. what I did, I was simply asking him a question. I asked him the question, what did you do in the last 48 hours? And he said, well, I was painting for the whole weekend. I was painting ceilings. So for the whole weekend, he did this movement and bending down. And so for the whole weekend, so maybe 15, 18 hours or something like that. And so, okay, that explains a lot. He said, what do you mean? He said, well, what's happening is you have your normal emotional defense system, muscular defense system. You've actually attacked that. You have decompensated. That's an old psychiatric terms. That means, and there will be slides about that, so that means if we have experienced developmental traumas, and most of us in the room would have had that for some reason, to a certain amount, there are certain things we call emotional defense system. They can be thinking, they can be not breathing properly. So we're defending against the pain of the conscious awareness, and that's where consciousness comes in. The conscious awareness of feeling the old, let's say, the old abandonment, the old fear, the old abuse, all of that is we are sort of defending against. And one of these defenses is muscular armoring, muscular tension. And in that case, and abandonment is in particular is the tension that contains and makes abandonment unconscious, in particular in this region. There are other regions for other feelings or other experiences. So the person, so he would have had, that would have all been quite tensed, collapsed, and he would have just done normal movements. So if somebody then all of a sudden does for hours and hours completely different movements, these defenses break down and people get flooded with their feelings. Does that make sense? Yeah? I'm sure some of, or quite a number of you know that already. So he had, through the work that he has done, he has what psychiatrists used to say decompensated. He got flooded by old traumatic feelings around abandonment. He also talked about feeling abandoned and feeling hopeless and nobody's there and feeling alone. So the stories that he told me were exactly also about that. So what happened then was, so I sort of explained the mechanism to him. We didn't do actually long therapy. He came for 2-3 sessions. But just understanding what happened to him, that he's not gone mad, that it has to do with feelings, that it has to, understanding the mechanism. He almost walked out with a smile a lot better. Then he came back, and within 2-3 weeks, I saw him 3-4 times, he has sort of found back to normal. That all established itself again. So instead of going to a hospital, just helping him to become conscious of what he was dealing with, that did the trick. Now, I'll give you another story. This is about myself. I feel a bit foolish saying that in a sense, because by that time I had already done about 7 to 8 years of psychotherapy myself, because I'm an incest survivor and I've had my really big fair share of trauma in my life. And I dealt with it through psychotherapy. So one day in Sydney, I arrived new in Sydney and I thought I'd buy myself a bike. So I was riding a bike from a suburb called Randwick to another suburb called Clovelly, where we lived. Put the bike aside. On that same day also, I took somebody to the airport, a good friend to the airport, and somebody else left. In the night, all of a sudden, I felt completely crazy. I thought, I have to kill myself. There's no way not to kill myself. I felt like I had a psychotic episode, sort of emerging at 8 o'clock in the afternoon. I wanted to grab my son, and so I left the house with him. He was about maybe 12 months old, and wanted to jump over the cliff. But there was a sort of 10% sense left. Wait a sec, Werner, you are a body psychotherapist. You should understand what's happening here. What is actually happening here? Sit down and think. What have you done today? So I therapized myself. I said, I hadn't been riding bikes for years. All of a sudden, I probably was riding a bike for 10 kilometers, and it completely, exactly has done the same thing. So the whole body-mind region around my hips, thighs, where I know I have very numb sections, parts, I had done the same thing that the person had done. I had decompensated. All this held energy, traumatic energy, had sort of risen up energetically. We talk about energy rising up, and when energy reaches the brain, it causes a psychotic episode. So I thought, okay, now I know what happened. I better go home, lie in bed, it will pass. So what that means is, can you imagine how many people commit suicide because that's not understood well in society? There would be tens of thousands out there, even in a large country, who commit suicide because this is not common understanding in medicine, in psychiatry, people don't know how this sort of body arousal, how that all works. That's sad, isn't it? To think that people jump over cliffs, jump in front of trains because they don't know, because they've painted ceilings and they don't know what happened about them. And of course, there's also often then a background of other trauma sitting on top of that. But some stress and that together kills people. So that's something I think where we really need to create consciousness in the public to make some changes. I think that's really unacceptable. So I've actually done 2 now. So we're back to number 3. The man with the rubber. Any question about that? So maybe time to inhale.
How did you kill yourself? When you discovered that, hey, this is happening, what happened?
I just calmed down. I was aroused. I felt mad. I had all these feelings, but I realized, well, I feel exactly how some of my patients are feeling. Sometimes this time it hit me. Oh, things calm down again. Things.
So this is my mom says, I was translating to her, but she's also in the field. In Chinese medicine, she said, well, you have this energy getting stuck.
Yeah.
And the Chinese way is meditation, qigong, or acupuncture to let it flow.
Yeah.
But not flow up, but flow down. So
that's exactly the point. Exactly.
So your healing process, when you talk with this painted ceiling guy,
Yeah.
how is that energy goes there?
Well, you see, this person was obviously very ungrounded in inviting all the energy up, dissolving all the armoring here, invited all the energy up, and it flowed into the person's brain and caused that psychotic episode. So that's exactly, so from a body psychotherapy perspective, we exactly say the same. The energy has to be brought down and out. We do something called exit massage. We actually, part of our work is helping, facilitating energy flow into the arms, into the legs, and that actually helps. I'll tell another story about that in a minute. Can you get an idea? I mean, look, I'm sure this is all Eastern, a lot of Eastern knowledge. It's just to say that the West has completely wiped this kind of energetic understanding. Please, yeah.
In Ayurveda, there is a panch prana and a das prana, and these pranas are actual movements of energy in different parts of the body in different directions, and it has parallel semantics. It's a long session, but
Yeah.
it has a relevance over here.
Yeah, and when you feel flooded like that, one thing we really do with our patients is we just sort of ask them to walk for 15 minutes in our office, and that actually brings the energy already down. Or we ask them to punch something, so that brings the energy out through the hands, and it immediately reduces that pressure in the head, as well as this sense of madness sort of slowly shifts. Yeah. So the man with the rubber wedge, I was working for the Multiple Sclerosis Society in Germany. We have a bit more time. And I was running sort of awareness courses for people with MS. You know what MS is? It's sort of a neurological disease. You would obviously be the specialist in that. I don't go so much into what it does, but here's an interesting story. So there were about 8, 9 people sitting in a room with me. I was the facilitator. We talked. about 5 or 6 in a wheelchair. And everybody told a story about their MS. And so we listened to the story. And here's a young man of about 19. He said, I'm diagnosed with multiple sclerosis. And I said, so what's your symptoms? He said, I can't open my knees. I can't, so he had and he was actually sitting there with a rubber wedge between his knees to protect his joints and his tissue. So he's sitting there in his thing with a rubber wedge between his knees because he had, under pressure, pressed his knees together. So I said, so tell me more about it. Does it happen all of the time? Now, these are questions that most reasonable people would ask, wouldn't it? But medical doctors have never asked him this question. So he said, oh no, that only happens when I'm with people. I can lie in bed in the night and I'm completely normal. And I said, oh, so that's a disease you only have when you're out there with people, when people can see you, when people can't see you in bed. You can completely relax? He said, yeah. So I thought, well, let's give that a try. So I ran to another building where we were in a sort of building like that, and there were outhouses with bedrooms and things. So I grabbed brought his doona in, and said, look, let's do a little experiment. Let's put the doona on top of your lap, and then maybe you feel a bit like in bed, where you obviously under the doona can relax. And it took only a minute, and we heard the plop, and the rubber wedge fell to the floor. And his legs fell apart, and for the rest of the session, he was sitting there and you think, what does that say about illness? Isn't that interesting? Again, from a consciousness perspective, how come these things are not found out? How come nobody's interested in the stories about illness? And multiple sclerosis is a fascinating story because it has so many facets. Some people they get tired after 20 meters, so they have to stop and look in the window. It's why it's called the window shopping disease. They are sort of...
Did you have the multiple sclerosis patch in the cornus medullaris, the lumbosacral area of the spinal cord?
Sorry, what?
The multiple sclerosis patch, was it in the lumbosacral?
Well, that's a good question. I did some studies. I actually did some studies because we have multiple sclerosis in the family. And my uncle was dying from it, and his son was dying from it. So that's how I became interested. And I had some symptoms when I was in my mad psychotic phase. I also had some emerging symptoms of MS. That's why I freaked so much. I thought, no, something has to happen here. So the answer to your question is, if we are about 40 people here in the room, probably about 4 or 5 of you, if we cut your bodies open, you would show symptoms, you would show the neurological signs of having MS. But is anybody here with MS? Probably not. So that is another one of these baffling things. Lots of people dissected for completely other reasons. They find exactly these lesions around the myelin sheaths are sort of destroyed or destructed. So this can be found in quite a range of people. Actually, a percentage of, I think I've learned about 10% of something.
Usually it is about 3 to 4%.
Sorry?
In a nutshell, if I put it in our understanding, our group understands, the nerve is coated with an insulation material outside. It's like the wire having the insulating rubber PVC coating that is missing in the areas where the MS patch is. When I asked him that question, in the lumbosacral area, if that cluster of nerves does not have the insulation, it has what we call a short circuit in simple terms, and that produces a spasm if it is excited. So when he has people and he's a little worried, this is what happens.
Yeah.
And if that is taken care of, it relaxes.
Yeah.
Basically, insulation which is missing.
Yeah, but at the same time, it's certainly also there when he lies in bed. It doesn't just disappear every time he goes to bed. So there's a much bigger story around that. And look, I think I don't have the time really to go too much into that. But the point is we have lots of illnesses around that don't have really a logical explanation. Or it should be looked at what it really is. It could be trauma, it could be sexual abuse. One of my colleagues has been in wheelchair for 12 years, and after working through in body psychotherapy through her sexual abuse history, she threw the wheelchair away and is like us. So lots of interesting things happen, but it's that the lack of consciousness and the lack of willingness, in a sense, in the Western world, with all our profit orientation and the need to buy big machines and stuff, where we don't ask the simple and make sense of the simple, most simple things around health and illness. Can I have another 10 minutes? So, what are we going? So, next one. Let's wheelchair on the veranda is another MS story. Let's not worry about that.
It's relevant to a lot of people if you want to say about back pain. Back pain, many people have.
Yeah, so I go for the back pain, and I go for one more story, I think. One more story, because that's a really new patient that I have. So about 3 weeks ago, I have a woman, she was sexually abused, and she's known about it for a long time. She's an ex-student at our institute. She's known about it for a long time. She then had an accident as part of her placement, and where she fell from a trampoline and broke her right leg, and there's lots of damage. She got a new patella, and a new, how do you call it, patella, a kneecap, yeah. So, but what happened is she has more than ever no feeling in her right leg. And so she's panicking, she's thinking of having her leg amputated. She's completely unhappy with her leg. She wants more surgery. The surgeons say, we can't do anything anymore for you. It's beyond us. She had another assessment. They all say the same thing. She's really frantic. So that's when she started to see me. So we are looking to get the energy going. So she can't feel it at all. So it's like this dead thing. So she can sort of walk like that and has a strap and stuff. So interestingly, and I make it short, so we've done some interesting work. We've analyzed lots of things, made a lot of meaning. The session that I want to come to happened about 3 weeks ago. So we did a session that we all know has a strong potential to generate energy. So it's like lying somebody on the floor, putting the knee in an ankle, dropping them aside, and then slowly lifting up the knees towards the ceiling. So what happens then is the muscular armoring, this emotional muscular armoring, gets tired. Gravity attacks that, it gets tired. Then involuntary movements come, jerking kind of movements. Once they start, the energy starts to flow. Yeah, energy, and so she went into this sort of trance. And she was really having a go, because she had her eyes closed and we lost a bit of contact. But I could sense how she, even in some strange sense, enjoyed this, because she started to really feel her leg, feel energy coming in. What happened then was interesting, and that's another good lesson. She then started, she's sort of having energy, the whole upper body starts to shake, and she goes into spasm in the base of the skull. Now, when that happens, we call the base of the skull the ring of last defense. That is where the brain protects itself from a psychotic episode, the brain from being flooded. So once she started to do this, I immediately brought her back. That's a warning sign. If I had let her go another 5 minutes, she would have had a psychotic episode as part of the therapy, if that makes sense. She would have been flooded. So I brought her out. I said, sit up, talk to me. She was like a zombie. Thanks God, the following client had canceled, so it took us about 25 minutes to bring her back into the room. So she became that child that had just been sexually abused in the room. Then she looked at me and she looked at the door, and so slowly we brought her back. And she said, oh, Werner, and she smiled, so I wasn't the abuser. So she all of a sudden, oh, this this is present and the other one was past, sort of thing, because she had sort of been there in a sense. The great thing was, I must admit, for a couple of seconds I panicked that I created a psychotic episode attack for her. But I think we caught her enough. And that's a great warning sign. If people tense up in the base of the skull, then you have to stop any intervention, anything, bring people back into the room and so on. Anyway, her leg is back. So the leg now feels on the inside completely full and warm, only the outside is ice cold. So that's where we have to continue our work, obviously.
Mainly the neck or the knee?
The whole leg. Oh, we're talking about the whole leg. She had lost the feeling in her whole leg. And so through this one exercise, the leg is coming back. Does it all make sense, hopefully? Oh, you just lie down. You just... Yeah, oh yeah. You have to lie down there. No. I tell you. Head this way.
Towards you?
And the feet this way. What's happening is, and then you make yourself comfortable. What's happening is, now they have to be down. So this has to be, if you move a little bit up, a little 10 centimeters. So that should be about the right ankle. You need something to hold your feet, otherwise you slip forward because you don't want any tension. You don't want to prevent any movement through your own will. All you want to do is let it drop. And then I would say to you, with every inhalation, move them up 2 millimeters. And another inhalation, move them up another 2 millimeters. So after about 3-4 minutes, when you're sort of halfway up, the movement will start. Jerking movement will start. And they become stronger and stronger and stronger. The interesting bit there is also, and somebody said before, you have to bring the energy down. So obviously a lot of energy would have moved down, and yet still, because a lot of energy also moves up. Energy goes, in a sense, both ways, up and down. And the energy updrift would have been dangerous if we had gone past her distress movements in the base of the skull. So once people, regardless of what's happening, if people go with distress in the base of the skull, you have to stop anything. Thank you so much. Unless you want to have a go now. So finally, let's talk about back pain for another minute or two. Essentially, it's sort of a new illness that we all have, and we have it because we sit in front of computers, we don't walk enough, we carry things. There are all sorts of reasons. Now, if you would go to a normal medical doctor, you probably, if you're lucky, the doctor will acknowledge and ask you about your lifestyle, about your work conditions, ask you to get a better chair to sit in, a more ergonomic chair. That's great, because part of it is clearly lifestyle related. But not only, it can also be psychosomatic, so it can be lots of things. The whole point I would like to stress at that in this moment is that there are choices. You can go the medical way, meaning maybe repressing symptoms with medication, or you can go a kind of yoga therapeutic way, which I guess many of you will be familiar with. So what we would do, we would simply say, let's do some, we don't call it yoga, we call it exercise. And the basic exercise is to feel it, to go into a position where you slightly feel the pain, and then you breathe into it. And to slow everything down, time slows down. So you breathe. And maybe you asked, I would ask the patient or client, how about we let your back talk? What's the story that your back could tell us today? And back could say, oh, I'm quite stressed and lots of stuff has come together, all that sort of stuff. But the point is to really find the cause. And they
Upper, lower, which one?
Oh, this lower back pain is these days is an increasingly big problem, the lower back pain. So, and there are symbolic issues, there is pressure, there's issue of not feeling backed up, There are a lot of, the whole symbolism of what comes with back and being backed up and having a strong back and bending back over, It's also a very language metaphor sort of scenario. But the whole point I'm making is to create awareness. Instead of taking the drug shortcut, to really look for the story, and what happens, and you would see that in the fourth part. So once you start exploring, once you start stretching, once you start breathing, lots of things will happen. You might start to yawn. Yawning being not so much a sign of tiredness, which is one of the errors that we make, but yawning often is happening when we do, for example, martial arts. Because when the body works with trauma, tries to integrate something, tries to heal, it needs oxygen, and that's what the yawning does. We draw in, and so that helps the body to, I guess, to sort of complete biological cycles. We also might get feelings of flow. We might get streamings in our body. We might feel gurgling in our body. We call it borborygms, and we use that system of borborygms as a feedback system when we do body work with people. We're actually listening to the sounds and make them audible to people and discuss them.
I have a friend who's an Ayurvedic doctor, and I asked him, my friend has back pain. What should he do? He said something very interesting. When we eat too much, we don't go to the toilet, it stays here. They showed me an exercise. Can I quickly show you? Is that a very brilliant exercise? Number one, and then going down. One, down.
Yeah. Yep, so again, just some more words about consciousness. I guess what I'm trying to say here is all these stories about illness, where people commit suicide, where people have multiple sclerosis, when they actually could and many other illnesses where they could find out about what it is. I've been working with people with AIDS, which is now by some understanding of psychosomatic medicine people, the new conflict between love and sexuality, not being able to bring love and sexuality together, which we had before. It was called tuberculosis, TB, exactly. So, there are interesting stories about TB in the same way, and so the new version is called AIDS. So there's so many interesting psychosomatic things. So I guess what I'm saying is it would be fantastic as part of our creation of a supermind, or the supermind, you know the term better. That could be an important part, helping people to understand their bodies, helping people to take ownership of their health and not immediately run with everything small to the doctor. Having said that, I think usually it's also a good idea to go to the doctor to make sure nothing very serious is happening, but then also do the own work. Yeah? So don't get me wrong, I'm not suggesting you shouldn't go to the doctor. Cancers can grow within weeks and kill a person. So we have to be very careful to make sure we are safe, that we have indeed the time to do the more slow yoga or psychosomatic medicine kind of work. And we have to be safe. We don't want to heal into death. We want to heal into life. Please.
So in general, then, a psychotherapist could help you get back to your own body.
Back to
your own body and your consciousness.
That's the whole scenario, yeah. And so it's what we do is like psychotherapy. We also talk a lot, but we, as you have seen, as we have heard about these stories, we involve the body a lot, considering that body and mind are a unity. The body was involved when we got traumatized, and the body can also be involved when we do healing. And yoga is doing exactly that in many ways. So, look. There are some more slides, but these slides sort of go into the more theory, what are borborygms, what breathing patterns. In a sense, we've talked about a lot of that in these 5 stories. So I'll upload that and you can do the rest yourself. Yeah?
Thank you very much.
Thank you.
We can discuss